Okay, good morning everyone. My name's Hannah Mace from Aspire Scientific, and I'm going to give the highlights of this year's poster session at the ISMPP EU meeting. So just to start with my own disclosures, just very briefly, I'm a principal medical writer at Aspire Scientific, so we're a medical writing agency. I'm also one of the team at thepublicationplan.com, which is a free online news service for medical publications professionals, and I did present a poster at ISMPP EU as well. So the theme of this year's meeting was advancing medical publications in a complex evidence ecosystem, and alongside the main meeting programme, ISMPP members had the chance to present their own research on this field through the form of poster presentations. There were a record number of poster presentations this year, 27 in total, and the meeting committee chaired by Laura McGovern from Apothecom, the abstract meeting committee, selected 6 of these to be presented as oral presentations too. And you'll see that I've indicated these with an asterisk throughout my slides. Just wanted to start really, first of all, by highlighting the absolute wealth of topics and research methods that were covered. Many more than I can possibly cover in my presentation today. So for the purposes of just showing you the highlights, I'm just going to split this into some key themes. And these were, I think, themes that were covered by most of the posters at the meeting, and also are particularly pertinent to our day-to-day work as publications professionals. So these were getting the research to the readers, involving patients, which was a really huge theme of the whole meeting and something that's set to continue to grow and grow, the role of professional medical writers, and also how we can advance our own profession. And in each of these areas of research, the research itself really fell into one of 2 buckets. So it was either very optimistic and showing us the strides forward that have been made, or just as importantly, I think we can argue, it showed us the work that's still to be done. And I should just mention that for each of these themes and for each poster that I discuss, I'm of course not able to discuss all of the comprehensive sets of data that were presented, but you can see that I've referenced the posters throughout, and I'll show you at the end where you can find more information. So step 1 in getting the research to the readers is having a clear, comprehensive and transparent report of the data. And Slavka Baronikova's team did this by analysing trial tracker data. And they found in their analysis that 75% of industry-sponsored data was disclosed. So they looked between 2006 and 2015. But still work to do, and some nice examples here of research from other groups that showed where there's still a little way to go in terms of having that clear, comprehensive and transparent reporting of research. The first example here from Matthew Booth's team, this was a team that conducted a representative literature review. So they picked a particular day and they looked at every systematic review that was published on that day and analysed whether those reviews fully met PRISMA criteria. And they actually found that over half of the publications they looked at didn't meet the criteria. Another group, Henrika Reisman's group, looked at consensus guidelines developed by the Delphi method in rare diseases. And they looked at both the methods used and the reporting of the methods. And they found that, again, somewhat surprisingly, often a systematic literature review hadn't been conducted as part of that process, and that the particular methods used weren't always reported in full. And they pointed out themselves that actually that information was probably available. It wasn't that the research hadn't been done, it's just that it hadn't been fully reported. And for me, this was a theme that you'll see comes up again and again in some of the research that was done. It's kind of easy wins that are being missed in a lot of these cases. So kind of small details, going the extra mile, not necessarily a lot of extra time or resource, but making that difference to the quality of publications. So on to step 2 of getting the research to the readers, open access. Something that was, as you can imagine, a huge topic in the meeting. Lots and lots was covered. So just to briefly mention a couple of key points, 2 different groups here, Charlotte Bell's group and also Jürgen Wein's group, reported that optometric scores were higher for open access articles in those articles that they analysed. So open access does extend the reach of an article. But other groups highlighted that barriers remain to achieving true open access. An interesting finding of Valerie Moss's team, they looked at clinical guidelines, was that 1/6 of clinical guidelines are still not free to access, which I think is just worth thinking about, pausing and thinking about that for a minute. So that means that doctors who are trying to make sure their patients get absolutely best practice care can't always access that best practice freely to find out what that is and ensure that they're applying it. They also found that even those that are free are not always clearly labelled as such on PubMed, which again seems like actually a fairly achievable detail. Tim Ellison's group, so this was part of NetworkPharma's research, they looked at the different types of licensing available to achieve open access. They analysed high-tier journals, those with an impact factor above 15, and they found that only 62% were offering what's called the CC BY licence, so the licence that enables the reader not just to read the article for free, but also to reuse the data it contains for free. Most journals that they looked at were charging around $5,000 for this licensing, but the really key finding that was subject to a lot of discussion at the meeting was that very few allowed this type of licence for industry-funded research. One of the points of discussion that was held in the wider meeting around this finding was that, is this an inadvertent form of publication bias if this data is not available for that purpose? So finally, in getting the research to the readers, after presenting a clear and transparent report of your data, making it open access, you need to let people know that it's there, extending the reach. Digital and social media, obviously hugely useful in this area. Lots and lots we could talk about here. So again, I'll just pull out a couple of key highlights. Another finding of Jürgen Wein's team was around tweeting. So they looked at the effects of publishers tweeting about articles that they publish. And they found that this did increase the overall number of tweets an article received above and beyond those ones that the publisher themselves sent. Another team, Andy Shepherd's group, looked at the effect of Congress activities. So what happens if a publication is published at the same time as a presentation is made at Congress about that same data? Unsurprisingly, the Congress activity generates extra media and social media coverage, but they found as well there was an additive effect there, and that Congress activity coverage did drive people back to the original publication as well. Another group, though, Neil Venn's team, looked at some of the opportunities being missed around Congress presentations. Quite an interesting one, again, in that it seems to be a fairly easy step to take, so it's interesting that so many authors are not taking it. They looked at a very big Congress where the Congress organisers really encouraged authors to upload digital materials as well as presenting their paper poster live. So fairly standard e-poster, they could also upload an audio file if they wanted to. 40% of authors didn't upload an e-poster, and so as you can imagine, very, very low numbers uploaded an audio file. There was some discussion at the meeting, as this was also an oral presentation, as to why this hesitation might exist. Is it around data being superseded at a later date? Is it to do with lack of control over what happens with your publication? But really something we have to face and work out how we're going to deal with as authors and publications professionals as conferences become more and more digitally focused. So on to the second theme, involving patients. A lot of good news here and some really interesting findings. The first piece of research that I wanted to talk about was Anna Georgieva's team's survey they conducted. So they looked at US patients and caregivers and found that actually 45% of those they surveyed are already reading journal articles. So the patients are accessing this information already. Half of those that they surveyed said they find it really useful. It helps them to be involved in their clinical decisions about their own care, and it helps them to have discussions with their healthcare professionals. Another piece of research in this area from another team was a survey of publications professionals and healthcare professionals, and found that they too, particularly publications professionals, are very enthusiastic to collaborate with patients on publications moving forwards. But also a lot still to do in this area, and I think unlike some of the other kind of finer detail things that I've mentioned earlier that seem like actually fairly easy wins to just make that extra step and be able to improve the quality, this is something that's going to be more of a mindset shift, and no doubt be something that we see more and more of over the rest of this year and over the coming years. So the same survey that I mentioned earlier, Anna Georgieva's team, found that although these patients and caregivers are accessing publications and they're saying, yes, we read them, yes, we find them useful, they're also saying they're hard work. There's jargon that gets in the way of patients really interpreting what information means. But also, importantly, and I think for any of us working in publications, something to have in the back of our own minds, the patients were finding it wasn't always clear how the conclusions of a particular study related to them and as a patient and their condition. Another piece of research in the same area, Eleanor Thurtle's team looked at journals that publish on rare diseases. And this is another one of those kind of easy win categories, I think. Only 5% of those journals require a lay summary. That's not something that takes a lot of extra work, time or resource to produce, but it could potentially make a massive difference for patients, especially in rare diseases where those patients are very engaged with the literature and with the information about their disease. The second piece of research here that I wanted to discuss was from Anne-Claire Wadsworth's team. So this was Envision and the BMJ, and they looked at patient involvement in clinical trials. So the BMJ have required all publications to include a patient involvement statement since 2014, and they also involve patients in things like peer review. So what they did was look at a little bit more detail to see, well, what type of patient involvement has been going on in the publications that we've published, what form does it take? And they found that actually in a quarter of the publications they analysed, patients weren't even thanked, let alone involved in any way further. In more than 40%, patients were involved in something like disseminating the trial results to those who took part in the study itself. That's kind of as far as it went. So less than 20% of any of the publications involved patients in something like the actual design or conduct of the study, and only one article included a patient as an author. So how can medical writers help in all of these challenges? How can we help to overcome some of these as we move forwards and as medical publications and the landscape continues to change? There was a timely poster presentation summarising the AMWA, EMWA and ISMAP joint position statement on the role of professional medical writers, which succinctly explains that role as being enabling the ethical, accurate and timely reporting of data. Other research from other groups further supported this. So there was a systematic literature review which looked at articles which had specifically themselves investigated the role of professional medical writing support, and found that this type of support is associated with an increased compliance with things like reporting guidelines, so consult guidelines in this case, and the transparent reporting of financial disclosures. And also a couple of surveys that looked at what authors think about professional medical writer involvement. One of corresponding authors, which found that 78% found this support to be very useful, and then one that looked specifically at Spanish-speaking authors who were publishing in English, and they reported that they would really value the support, but they can't always access it. Barriers exist in their case. And finally, a little bit of self-reflection, I think, having talked about some of the easy wins that perhaps we ought to be making to just refine and continue to maintain quality, some of the bigger changes in mindset, like involving patients and changing how we think about open access licensing and how that's made available. What can we do in our own day-to-day work as publications professionals? So one piece of research which really stood out to me was an analysis of ISMAP abstracts. So this author looked at abstracts that had been published at the EU meeting and global meetings from 2006 onwards, and found that only 5% actually became full publications. So maybe we need to practice what we preach here and start publishing some of our own findings and continuing our own research as well, so that we can make those full publications. Another important point that was made was the need to reach out across the field of medical publications to other disciplines within it. So the kind of cross-stakeholder interaction that I mentioned earlier. A really nice example of this was from Karen Woolley's team. They conducted an awareness survey at last year's peer review congress. So they surveyed poster presenters at that meeting and asked them, do you know what a medical writer is compared to a ghostwriter? Are you aware of the CMPP qualification? And are you aware of the joint position statement that I mentioned earlier? And they found that although more than 80% were aware of the difference between a medical writer and a ghostwriter, less than 30% were aware of those kind of extra markers of quality. So clearly some education and advocacy that we still need to do across our own industries here. And finally, communicating within our own industry. And for full disclosure, I should mention that I'm now talking about my own team's poster. So the website that I mentioned earlier, thepublicationplan.com, is a service that provides news and updates for publications professionals. And we looked at how the community engages with that type of news online. And we found it really interesting, and something that probably differs from a lot of other spheres of professional and just public life in general, was that while people in the publications industry value those kind of articles and they read them and they'll say, yes, that was high quality, yes, that's the website I go to get that information, they don't have a conversation with each other online about it. They just use that information and go to the next source of information, the next article that they want to read. So really having those conversations, we're not going to drive standards forward without that. And that's something perhaps we all need to think about a little bit more in our own work. So just to finish with letting you know where you can find out more information and the full details of some of these presentations that I've talked about today. All of the abstracts will be published in April's edition of the Current Medical Research and Opinion. The posters themselves are available to ISMAP members on ISMAP's website. And as I mentioned, our website has general publications news, but also we'll have meeting reports as well. And of course, please feel free to contact me if you have any questions about anything that I've presented today. Thank you very much.